Hello everyone, today I'll be speaking on the topic Dracunculus Medinensis, also known as the guinea worm, and it is classified under the tissue nematoda. So here's the illustration of how this guinea worm looks like, and it has a spiral shape. Now moving on to the brief introduction. Now these parasites are commonly found in countries such as India, Pakistan and Africa. Due to the reason that these countries are heavily populated and thus the parasites have the ability to contaminate this water, and upon consumption, the humans get infected. So here is the pathogenesis of how these parasites actually infect the humans. So the first stage being infection, the disease is transmitted to humans by drinking water from the larvae of Dracunculus Medinensis, which reside inside copepods. Now these copepods are small crustaceans. The larvae are released in the stomach and penetrate the mucosa of the stomach and the intestinal wall, migrating into the abdominal cavity. So that is the first stage where humans they consume contaminated water, and therefore these parasites have the ability to penetrate to the mucosa of the stomach and intestinal walls and eventually migrate into the abdomen. Moving on to maturation. The larvae mature into adult forms over a period of about 1 year. After maturation and impregnation, the male worms die and the female worms migrate through the subcutaneous tissue, usually distal lower extremities. Emergence. The female worms emerge from the skin, usually on the lower limbs, after forming a painful blister at the skin side. This process is often triggered by the infected person immersing the affected limb in water to relieve discomfort. The last one, larval release. During emergence, the worm's uterus prolapses through the skin, releasing motile larvae into the water. These larvae are ingested by cyclops. So as you can see at the bottom of the slide, I have provided a diagram. So that the aquatic microorganism is actually cyclops. So which undergoes two molds to develop into the third stage larva, starting the life cycle again. Now here is a diagrammatic representation of the life cycle. So the first one, which is infection, again it's the same process. The humans they consume the contaminated water which contains the copepods, and inside that copepods there is the larva. So once humans consume the contaminated water, the larvae are released when the copepods they die. So once it's released, it penetrates to the mucosa of your stomach and the intestinal walls, and eventually they reproduce in the subcutaneous tissue. So fertilized female worms migrates to the surface of the skin and causes a blister and discharges larvae. So level 1 larva released into water from the emerging female worm. Female worms to emerge from the skin 1 year after the infection. So this is simply like when a blister is formed, the larva will yeah will discharge from the skin surface, and once goes into the water gets contaminated again. And from there, copepods, which are already present in the water, they consume this larva again, and eventually these copepods become infected again. And once the copepods have been infected, other aquatic animals such as fish and frogs, they consume the copepods and they become infected. And as the biological food chain goes on, humans, for their survival, they also consume aquatic animals such as fish. So when this aquatic animals such as fish, they're undercooked or uncooked or not prepared well, then upon consumption, the humans eventually they get. So the whole life cycle continues eventually, and this is how it works. Now moving on to the symptoms and diagnosis. The clinical manifestations are localized but incapacitating. The worm emerges as a whitish filament. Duration of emergence is usually from 1 to 3 weeks. The center of the painful ulcer accompanied by inflammation and frequently by secondary bacterial infection. So I've provided a cute little diagrams over there for just for easy understanding. Now moving on to the diagnosis. Visual observation of skin blister, as I have already mentioned before, the woman's serpentine presence beneath the skin can be seen. Induced release of larvae from the skin also by applying cold. Microscopy can identify the special edges of the worm. An intradermal test with antigen elicits positive response. Treatment: extraction of the worm. The adult worm is extracted from the patient's body using a stick at the skin surface. Now I'll be showing you a sketch after this slide, and the process is actually quite simple. A simple piece of stick is used, kind of wrap around the parasite and then pull it out of the skin. Then we have pain management, such as aspirin or opioids are given to help manage the pain associated with the extraction process. Wound care, the wound is cleaned and dressed with fresh gauze to prevent secondary bacteria. So this is the image I was talking about, extraction of the worm. So as you can see, there is a piece of stick and the worm is kind of wrapped around it, and yeah, kind of looks uncomfortable, but that's how it's done. And yeah, those are my references. Now that I have come to the conclusion of my presentation, thank you for your attention, and I really hope that you learned something out of this short and very brief presentation. And all of you have a blessed day, evening, or night, depending on the time frame you're watching.